my name is Eugene. Today I'd like to share with you all my current understanding of biomechanics in regards to the ribcage and the pelvis. So let's start off with the common pelvic pattern. So most of the time people are in the anterior tilt position, and when you are in the anterior tilt position, if you do not arch your low back, you will just fall down. Okay, so pelvic is on top of ribcage is on top of the pelvis, and if you are in anterior tilt and if your ribcage follow down, you will probably fall down. So you will arch your low back and then you would flare your ribcage. So this is the position that you are in the common pattern. Okay, so the whole purpose is for us to try to stack your ribcage on top of your pelvis, okay, by doing this from this position. So the ribcage, when we breathe in, is supposed to expand, open up, and when we breathe out, it's supposed to close down. Okay, so imagine this as your ribs. As you breathe in, it's supposed to open, and as you breathe out, it's supposed to be able to close. They are supposed to be able to work independently. And most of the time, people have really tight back muscles, and when they move the rib cage as a whole thing, okay, rather than being able to do segmental movement. And according to Postural Restoration Institute (PRI), this is the common pattern of the rib cage. The right side of the rib cage is more depressed. The left side of the rib cage is flaring upwards. So if you can check it on yourself. Usually your left side of the rib cage would be closing down. Okay, and when you're in this position, your right side of your hand internal rotation will be limited, will be less compared to your left side, and your left external rotation will be more limited compared to the right side. So your scapular position is determined by the position of the rib cage. Okay, so the whole thing is trying to, from this position, bring it back to neutral. And of course, when you are in this position, the muscles, some will be tight, some will be weak. It's all because of the orientation of the rib cage. In the past, I've been focusing a lot on trying to release muscles and soft tissue work, but now I've changed my thoughts, and the focus is on more regaining the orientation and getting the rib cage to move segmentally. Okay, and as you know, our internal obliques, external oblique and transverse abdominis attached to the lower ribs area, and then when you engage your external internal obliques, you are able to bring the lower ribs down and in. Okay, so rather than using your rectus abdominis, the six-pack muscles which attach to here, if you engage too much of the six-pack muscle, is overdeveloped, you will depress the rib cage. So we do not want this. We want to use our obliques to bring the ribs, lower ribs down and in. The reason why we want to emphasize this movement is because the diaphragm, there's a dome-shaped diaphragm here, and as you breathe in, the diaphragm goes down, and as you breathe out, the diaphragm goes up. And it's because of this movement, when you breathe out, the diaphragm is able to ascend upwards. Okay? And we always want to focus on the exhalation part more than the inhalation, because when you are able to exhale more all the air out, you will automatically inhale in a better manner. And another thing is that if your spine is too kyphotic, meaning too curvy, or is too extended, then you have issue with your shoulder. Because notice that it is natural for us to have a mild curve in the thoracic spine. And the rib and the scapula is also a little bit curvy, okay? So with the curve of the thoracic and the curve of the scapula, you are able to glide your shoulder, glide the scapula up. Okay, so if it's too curvy, then your scapula will be stuck in certain position, and if it's too extended, again, you can't lift your arm upwards too. So rather than always focus on the muscles that's surrounding the scapula, sometimes we need to focus on the position of the rib cage, position of the spine, get it into a more neutral position to allow the scapula to be able to glide against the rib cage, the surface of the rib cage. Okay.